here. We are going to teach about pap smear. And kindly patient, if you have a question or you need me to slow down while I'm teaching you about pap smear, kindly stop me or raise your hand or just tell me to stop or slow down. So you might be wondering, what's pap smear? Pap smear is a very common test. It's used globally to test for cervical cancer. It's usually used to screen for cervical cancer, and the good thing is, if this test detects cervical cancer at an early stage, there's a higher chance or probability of finding the cure for cervical cancer. And it's usually, this is how it's done. It involves collecting cells from your cervix, the lower cervix, the narrow end of your uterus that's at the top of your vagina. Detecting a cervical cancer early with a pap smear gives you a greater chance at a cure. A pap smear can also detect changes in your cervical cells that suggest cancer may develop in the future. Detecting these abnormal cells early with pap smear is your first in halting the possible development of cervical cancer. And then I'm sure as a patient you're wondering, why is it done? Does it have to be done? So pap smear is usually used for screening cervical cancer, so it's very, very basic and important. And then the pap smear is usually done in conjunction with a pelvic exam. In women older than age 30, the pap smear test may be combined with a test of human papillomavirus, the HPV, a common sexually transmitted infection that can cause cervical cancer. In some cases, the HPV test may be done instead of a pap smear. And then, as a patient, sometimes the patient asks, who should have a pap smear? Is it for everybody? Does it have a time limit? Does it have an age limit? Yeah, most doctors recommend pap smear to be done between age 21 and 65 if all factors remain constant. But there might be other cases that where the age sometimes doesn't matter. If it's above 65, they usually tend to keep on doing the pap testing. So how often should a pap smear be repeated? Like I said, unless the other risk factors, the doctor will advise the women to do pap smear every 3 years. That's for women between age 21 and 65. But women at the age 30 and older can consider pap testing every 5 years if the procedure is combined with the testing of HPV, or they might consider HPV testing instead of a pap test. If you have certain risk factors, your doctor may recommend more frequent pap smear regardless of your age. And the risk factors, they include if you have a diagnosis of cervical cancer, if you have a history of smoking, if you have a HIV infection, or rather if you have weakened immune system due to organ transplant, chemotherapy, or chronic corticosteroid use, there might be a higher chance of the frequency that you get tested. The pap smear testing is done. So yeah, sometimes you wonder, at what point do I stop pap smear? Am I going to do it for the rest between the age 21 and 65, or do I stop it at a certain point? So there are some situations that can lead to the doctor advising for you to stop pap smear testing. These include if you've done a total hysterectomy, the surgical removal of the uterus, including the cervix, and then if older age, that means women above 65 years. Sometimes the doctor recommends at 65 you stop doing the pap smear, but sometimes the doctor might recommend you keep on doing the pap smear testing if a woman has multiple sexual partners. So regardless of being age 65, you might consider doing more testing. So I know as a patient here, you might be wondering, what are there risks for doing pap smear testing? Is it very safe? Pap smear is a safe way to screen for cervical cancer. However, a pap smear isn't foolproof. It's possible to receive false negative results. That means that the results indicate no abnormality, even though you do have abnormal cells. So, a false negative result doesn't mean that a mistake was made. The factors that can cause a false negative test include inadequate collection of cells, a small number of abnormal cells, blood or inflammatory cells obscuring the abnormal cells. Although it's possible for abnormal cells to go undetected, time is on your side. So cervical cancer takes several years to develop, and if one test doesn't detect the abnormal cells, the next test most likely will. So you don't want to get so scared at the first test or it didn't turn out the way expected. So you can come back more for more tests, and then it can prove otherwise. Are there any question? Oh, good. We're on the safe side. So how do you prepare? You're wondering, how do you prepare before you go in for pap smear? So to ensure that your pap smear is most effective, there are tips that the doctor advises. Usually they advise women to avoid intercourse, to avoid using any vaginal medicines, creams or jellies for 2 days before having a pap smear, as this may wash away or obscure abnormal cells. And also they try to advise for women not to schedule a pap smear testing on your menstrual days when you're having your menstrual periods. So it's best to avoid this time of your cycle if it's possible. You're wondering what to expect during the pap smear testing. Yeah, it's better to know what to expect than get surprises. So during the pap smear, a pap smear is performed in your doctor's office and takes only a few minutes. You may be asked to undress completely or from the waist down. You lie down on your back on the exam table with your knees bent. Your heels rest in supports called strappers. Your doctor will gently insert an instrument called a speculum into your vagina. The speculum holds the walls of your vagina apart so your doctor can easily see your cervix. Inserting the speculum may cause a sensation of pressure in your pelvic area. Then your doctor will take the sample of your cervical cells using a soft brush and a flat scraping device called spatula. This usually doesn't really hurt, but while the doctor is doing all these, they'll explain every step, so there are no surprises. Yeah. Do you have any question? Okay. So about the pap smear, after the pap smear, we usually expect to have normal results, but sometimes there comes in abnormal results. So but after the pap smear, you can go about your daily without restrictions. So depending on the type of the pap testing you undergoing, your doctor transferred the cells sampled collected from your cervix into a container holding a special liquid to preserve the sample. The samples are transferred to a lab where they're examined under a microscope to look for characteristics in the cells that indicate cancer or precancerous situations. Then the doctor, you can always ask your doctor, when do I expect the results back? And then after the results are out, then we usually expect normal result, but at times we don't get the normal result. But for the normal result, that means your pap smear results came back as negative. So probably after this, you might not need any more further treatment or testing until you are due for your next pap smear or pelvic exam. This is what we as doctors, nurses, the healthcare team expect most of the times. But there are a few times that we don't get the results as normal and we get the abnormal results. These usually cells were discovered. This means the cells were discovered during a pap smear. They were said to have a positive result. It doesn't mean you have cervical cancer. What a positive result means depends on the type of cells discovered in your yeast. So after this, if the doctor thinks the results were abnormal, it might require some more tests done for you to be sure what's going on. And if cancer is detected, then the doctor will start your treatment. So the pap smear is quite a very basic procedure or test that we need as women. And I would advise that if you get a chance, or if you can talk to your doctor, kindly do the test. So do you have any questions for me, or is there anything you want me to explain? Okay, thank you.